paper is only of 50 marks. That is where the deficits, the expected marks are, and deficit is less because of the less total score of IT as compared to other three which are equal, 80 each.
Nice observation. Anything more? Anything more?
So one thing is that we cannot compare the scores because they are not standardized.
Forget about your standardization. It is the applied psychometrics. Okay. It is the counseling situation. The patient came to me with the complaints of depression, high level of depression. Okay. And after taking the case history, I find that the client has main problem related to the career anxiety. Okay. Now you follow, there are 4 ranks. Can you see the rank?
Yes.
The last
Yes.
one.
The R1, R2, R3, R4.
Okay, correct. So R1, what is the deficit in case of the R1?
10.
30. 30.
30, right?
Yeah, 30.
And
The difference
R2?
between the X.
Yes, R2,
30.
R3, no, R2 not 30. R2 is 25.
Yes, sir. Yes, sir. Yes, sir. 25.
And R3,
15.
not 15, 10.
So that is 30.
No, 10.
First 30, next 25, next is 10,
Yes, sir.
and next is 15.
Yes, sir.
Okay. And what is the first preference?
Cost management accounting.
That is the 3. Information technology, right? 4 papers are there, right? One is the cost
Yes.
account. Another one is the
Indian
is this?
financial system.
Can you make it landscape? Farah?
Yes, sir. Yes, sir. Yes, sir.
Make it landscape, so it would be easy. No.
No.
Okay. What is the second one? Second one is the Indian financial system. Third one is the information technology. And fourth one is the
Mathematics and
statistics. Okay. And you have noted that is the deficit is less. Where?
In third, information technology.
Yeah, deficit is less, right? Because the expected marks is 50. So 10
Yes,
is
sir.
the deficit.
Yes, sir.
Sir, can you summarize what is going on? I joined just 5 minutes before.
Why are you late?
No, sir, actually
Okay.
it is on 8 o'clock, no, sir. So I joined
Okay.
just before
Now
8.
the thing is that the patient came with a high level of depression. Okay. Patient is always crying. And after taking the case history, I find that is the patient main problem is the carrier anxiety. And patient examination that will be held from maybe from 6th January. Okay. And what is my observation? That is the patient's expected score is 65 on which subject?
That is mathematical and statistics.
Very good. And you go to the rank. Farah,
Yes, sir.
now you see
Yeah.
that is the patient expected. That is academic self-efficacy of the patient. I am not using the patient, I'm using the client. Okay. So my client academic self-efficacy very high in case of the mathematics and statistics. Okay. But with respect to the preference, the client gave least preference. Can you follow? Why does it happen?
Yes, sir.
Why does it happen? And and the client's preferred subject is the 3, right? So R1. 3 means information technology. And the second preference is the
Cost management.
costing.
Accounting.
Okay, this client is basically from the BCom student. Okay. So why I collected this information? Can anybody tell me? Here, have I administered any standardized instrument? No, nothing, right? It is a simple mathematics. Only the score deficit and the preference. What does it mean? That means the client feels ambiguity in studying the subject. Okay. That is which subject he prefers most and which subject he does not prefer. But the academic self-efficacy very high in case of that subject. That means there is some ambiguity. So as a counseling psychologist, you have to find out. So if you give the patient the antidepressive drug, it does not help. So what will be the intervention strategy? Shima?
So counseling regarding the expectation of marks or the efficacy.
Counseling related to first?
The
Yes,
expectancy.
Yes, first one, that is the counseling related to stop the ambiguity. Because this ambiguity causes anxiety and that leads to the depression.
Okay.
Number 1. Number 2, since ambiguity is there, procrastination is high. So when there is some ambiguity leads to anxiety. Anxiety leads to procrastination. Procrastination leads to the failure. Failure leads to depression. Again, the depression, again in circular way, depression leads to, again, procrastination, again the failure, again the depression. So that is the cycle. So what is important? You have to break the cycle. Is it clear? This is
Yes,
the
sir.
function of applied psychometrician. That means in any situation wherein you want to solve the problem, you have to collect some data. And through that data collection, you can think about the intervention strategy. And that is the function of applied psychometrician. So how do you interpret the graph? Okay, so the
So-
graph interpretation, that is vital. So this is a counseling situation. Okay. I have requested my client to draw this line chart. I guided him and finally he drew it. So what sort of counseling you can provide? So that is the strategy. Okay. Thank you. So now stop share.
Okay.
Hello, Amruta, how are you?
Hello, sir. I'm good.
What is the temperature in your place?
It's a bit cold.
Bit cold. You are from which place?
Mumbai.
Another from Mumbai, she told not very cold. What happened?
I mean, I don't feel that cold, so
Subjectivity, sir.
Subjectivity. Correct. We psychologists, we always can understand each other. Is there anyone who can tell me the difference between psychometrics and applied psychometrics? What is the difference between psychometrics and applied psychometrics? I have given the note. What are the 5 differences? I think Shara has written something. No? Oh, Farah has sent. Okay, students, you know, please respond. Okay, Farah, your student has no idea.
Sir, I send it to them. Sarah, Amit, I think you know. Sarah, Pooja, you also know. Just,
One which
just,
I understood. One
yeah.
which I understood is the application of psychometric principles to solve a problem in daily life.
Good.
That is one difference.
Yeah. You're
So
right.
what is the function of psychometrician?
To apply the principles to solve the problems means application of those principles to, in terms of psychology, I don't know if the patient is coming, then application of these principles to find out about solution for the problems.
So one of the benefits of applied psychometrics is objectivity. It helps to take decisions in try to minimize the bias, the subjectivity which comes while offering counseling and offering help in many ways to clients. Just like in the previous example, we can help a person through applied psychometrics to take a better decision in terms of career.
Okay. Any other? Suppose the reliability coefficient, okay, in this current scenario, the reliability coefficient, whether it is high or low. In this current case. Or the relation between the subject preference and the expected marks. Do you find any high positive correlation between the two?
No, so
Correct. So this is the observation of psychometrician. Okay. Now, what will be the function of applied psychometrician here?
From this line chart which you have drawn, there is something, there is expected marks and a deficit line, which I understood because I am not from psychology field. So
It's okay.
that gap which is there between that
Mhm.
upper line and below line, that gap we need to fill.
Mhm.
So there we need to intervene something.
Correct, correct. That means we have to remodeling.
Okay, remodeling.
We have to remodeling. So that after your intervention or after the intervention, you will find that is this academic self-efficacy and the rank preference that will be positively related. Is it clear or not?
Can you
Yes,
just
sir.
again explain the correlation part? Means how you have their intervened in form of correlations. Means I did not understand what is correlation there.
So what will be the expected positive correlation? What will be the expected correlation?
Positive
Expected
correlation.
correlation will be the positive, right?
Right.
Because usually we are getting good marks in our preferred subject, right? And we are getting relatively less marks in case of the least preferred subject. So it is a
Okay, sir.
positively correlation.
Okay, sir.
Is it clear?
Yes, sir.
But our client has presented the data in such a manner where we find the correlation is very poor.
Sir, that is what I have not understood. Means the poor correlation means what, sir? Means low positive?
Yeah, poor correlation, yes. It may be 0 because it shows that is the most preferred subject. Okay, and the least academic self-efficacy.
Okay, means poor means you are taking it as low positive,
Low.
or either 0.
Yeah, low or 0 like that. Okay, so this is the observation of the psychometrician. But the applied psychometrician will remodel the data by changing the respondent's cognitive function or affective function. Or you can think that is the psychological faculties.
Sir, what did you say about remodeling? Means by which method, sir?
That is the counseling, guidance, training. Okay. So through this, you can change the cognitive function of the respondent or the subject or the client. So what is important? The applied psychometrician is the interventionist. Applied psychometricians are designing several intervention procedures to change the coefficient. Is it clear or very difficult? Please. Otherwise, it becomes complicated.
Okay, sir, I understood little bit. Yes. Now I understood.
Pauravi,
Yes,
what
sir.
is the meaning of positive correlation?
Positive correlation means if one factor goes up, the other factor will go up with it, or if one factor goes down, the other factor will go down with it. Very roughly.
So this is the positive correlation. And Shara, what is the negative correlation?
So when the factors move in opposite directions. So if one is moving higher, the other will, as in one is increasing, the other will decrease, and vice versa. So they move in opposite directions.
Very good. Amruta, what is zero correlation?
Yes, sir. So there is no correlation between the two factors. That is, they both are unrelated to each other.
Then what will be the graph?
The two things will be different. There will be no line graph as such. They will not intersect.
So what will be the graph? Pooja,
It will be
for the zero
scattered. No?
correlation?
So it will be parallel to
Zero correlation. Amit?
Sir, in zero correlation, sir, actually the two variables will be, if you want to draw any line, it will be almost parallel to the x-axis, transverse almost.
So data is scattered all over the graph. No lines between the scores can be drawn.
Okay, so whether it is arrow-like or it is plus sign.
Not arrow type,
Then
because data is scattered all over the plot. Like we cannot assume anything by zero correlation.
You cannot draw a line, sir, there. Means line is not at all possible there.
so it will be plus sign. Okay.
Okay.
If it is zero correlation, that means it will be the plus sign. Shima, you are right.
Yes, sir.
Because the total data will be very much scattered.
Yes, sir.
Okay. And why do we make the line? Suppose the
to know
two
the
variables,
direction.
they are making the positive correlation. Okay. And why we do make this line?
Sir, do know the direction by graph means more feasible. We can see and to know the direction of the correlation, the graphical presentation of the data.
Whether the variables are moving in one direction, opposite direction. That can be interpreted very easily with the line.
Suppose X and Y axis is there, and the line starts from 0 to the top. Okay, the regression line.
Okay.
It starts from 0 to top. And another line, it starts from 30 to top. So what is the difference between the two?
So no difference. So because if we the direction is more important if the 0 to top and from left to right, the arrow goes to
Yes,
left
from
to
left
right.
to right, one from 0 to top,
Okay.
another one
Top
from
means what,
30
sir?
to top.
Top means what, sir?
Goes upright.
Actually, in X and Y axis, we always see that the arrow is going obliquely. So that top you are asking or what?
Hmm. Okay, I am showing you the whiteboard. Is it visible?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So one is moving like this. Okay. And another is moving from here to here. So this may be 100. And this is the 0. And this may be 30 or 40. So what is the difference between the two? What will be the correlation coefficient for this one and the correlation coefficient for this one? Is my graph visible?
Yes, sir.
Okay, so can you tell me that is
So
the correlation coefficient for the upper part and the correlation coefficient for this lower? Which will be high? This side will be high. It starts from 0 and it starts from 30. Okay. So
It starts from 30.
the
So
correlation will be high.
So the one starting from 0 will possibly have the like r is equal to 1 because it's the perfect line, and that which starts from 30 will have a lesser correlation coefficient.
Correct, correct.
Okay.
Is it clear to all of you?
Yes, sir.
But who said that 30 will be the high?
Seema.
Okay, Shima. Is it clear now?
Yes,
Why
sir.
not? The reason is very simple. Suppose, so this is the y, okay. So this is the y-axis and this is the x-axis. Okay. And one individual falls here. So if you draw one line, I'm just writing here, maybe a little bit jig-jag, but don't think it otherwise. Okay. So based upon this data, you can predict the data very quickly. Because the correlation coefficient here, it is 1. But you follow, suppose this individual is here. Okay. What does it mean? That means relatively less predictive power for this line, but the predictive power is very high for this particular line. Okay, so this is called the regression line. Is it clear? If you have any question, you can ask me.
So, sir, here the correlation will be both high in this starting from 0 and there it will be low.
Yeah. So this is the A. Okay. And this may be B. Is it clear? So A line has maximum predictive capacity in comparison with the line B. Because the intercept, where it goes. Oh God. I do not know what. Now you find out, suppose that some data, okay, these data are here. Okay. So maybe two sides of data. Okay, suppose this is the interview data. This is the interview. Okay. And this is the written test data. Okay. Is it clear to all of you? So there is one regression line. This regression line starts from here. Maybe it is 20. And some data falls on the regression line. And some data are away from the regression line. Okay. So which individual will be selected for the job? On the regression line or outside of the regression line or away from the regression line?
So on the regression line.
Who says?
So
Pooja.
So on the regression line only because it is highly correlated there.
Okay. Very good. So on the regression line, so what will be the task of the applied psychometrician?
Problem is what, sir, means we need to generate the problem first to solve it. So what we are expecting in terms of problem? Is why they are not selected, other ones.
Yes.
So
So
if
this
they
is
re-
called the remodeling. Okay. So this is the least square. So from here, if you draw the line from here to here, and this line from here to here, this line from here to here, and this individual from here to here. So what will be the function of applied psychometry?
how to bridge that gap is to bring that interview into that line.
So what will be your planning? That means your planning will be 1, 2, 3. So you have to train these 3 individuals because they are very close to the regression line. Is it clear?
Yes.
So if you can change them, possibly they can change the who are far away from the regression line. So you can consider 1, 2, 3. So that means you are remodeling the data. Is it clear or any question? If you have any question, Puravi?
No, sir. I understand.
Is it clear?
Yes, yes.
So which is better, psychometrician better or applied psychometrician better?
An applied psychometrician.
Okay. So for that reason, I have conceptualized applied psychometrician. Applied psychometrics, I conceptualize in this manner. That is how I can remodel the coefficient, how I can change the regression line. Because the regression line is based upon subjects' own cognitive functions. Subjects' own, that is the competency level. So as a psychologist, what will be my function? That is the intervention. Is it clear? Farah, is it clear? Hello, Farah, are you here? Amrit, is it clear to you?
Yes, sir. But sir, just one question. Here when you have drawn that line, again that line is not in positive correlation. Means it is almost like in previous diagram where the it is starting from some, not from 0 but from above.
Starting from 30.
Yeah.
Yeah, so 0 is the ideal condition. Okay.
Okay.
0 is the ideal condition.
Because the correlation coefficient value is from 0 to 1. That's why.
Yeah, it is the ideal condition. Just like normal distribution, that is the ideal condition. So is there any data that follows only the normal distribution? No. Some difference will be there. Because the mean, median, mode, that will be the 0. It is the ideal condition. So from 0, there is this, if the correlation is that, it is just 1. That is the ideal condition. But again, since it is positively, the line is this very clear. Okay, the regression is line very clear. Maybe it does not start from 0 or not from 10 like that. It may be from 2, no problem. But definitely one can tell you that is, it is always better if the regression line So this is called the intershift. Okay. This is called the intershift. And this 0 means basically the mean. So it is the ideal condition. So this is this intershift. It starts from here. Okay, now I am going to my note. Okay, so this is the psychometrician. Psychometrician is very busy for the item analysis. So which item is better? Who can tell me? Red or blue? Item 1 is better or item 2 is better?
Item 1, this sir, 2, sir.
Amit is 2. Shara?
So the blue one.
2. Okay. Amruta? Pooja?
So item 2, blue.
Everyone follows 2. Why 2?
Sir, same question.
Because
Because
correlation is good, sir.
Correlation is good.
But item 1 has the perfect 0 score and the highest score.
So which is better? 2 or 1?
Sir, 1 because we can differentiate.
Yes, earlier you have told 2. Now you are telling 1.
Sir, what I think like item 1 has perfect 0 and the highest score also. Then we can differentiate the items.
Very good. So item 1 is the good item. Its discrimination power is very high.
Yes, sir. Because it has perfect 0 as well
Very
as
good.
the highest score.
Correct, correct. Is it clear now? So this is the issue for the psychometrician. And what applied psychometrician will use? Busy with item modeling by introducing skill development courses. So what do you mean by the item modeling? What is the meaning of item modeling?
By the writing down of the item again?
No, that is the function of psychometrician.
Okay.
So what is the meaning of this data? This probability, correct, and ability?
The possibility of having a correct answer on an item is probability correct. And
Yes, and
the
then
performance of the person is ability.
yeah, so the applied psychometrician will deal with the item 2, not the item 1. Now, can you tell me why?
To develop the
Item-
more
item-
discrimination power.
Item 2 is not discriminating properly between the students or whatever is our interest candidates.
Okay. So now it is clear to you. Just to imagine. 2020, first time we heard about the COVID-19. Okay. And 2019 March. If there is any question, what do you mean by the COVID-19? Can you give the answer? No. Because you do not have the knowledge about the COVID-19. Okay, but now you have the very clear-cut idea about the COVID-19. In 2018, you do not have very clear-cut idea about the importance of the online teaching. What do you mean by the flipped learning? Blended learning? You have no idea. But in 2022, you have the knowledge about what is blended learning. In 2022, you are very much aware about how to present the paper in PowerPoint presentation. But in 2018, you do not have this knowledge. Is it clear to all of you or any question? So,
No, sir, but you have given the
function
examples.
of the applied psychometrician is to remodeling by using the skill, development, etc. If there is no item ambiguity, because there is no item ambiguity, if the question is like that, what is the meaning of COVID-19? A, B, C, D. A is it is sweet. B is it is virus. C is it is medicine. And D is it is the name of any mobile phone. So do you have any idea? A, B, C, D. What will be your probable answer? At that time, what will you do? So this item does not have any discrimination power. For example, if you ask the question, what is the difference between psychometrics and applied psychometrics? People do not have the knowledge. They will be confused. They will give the ambiguous answer. And when you train them, when you give the adequate knowledge, then they can answer the question properly. Clear? So this is another one. Psychometry is mainly used for theory building. But applied psychometry is mainly used for problem solving of one's institution or regular life. For example, yesterday, what I have done, action research. Have I developed any theory? No. Okay. So psychometrician's function is this one. What will be the Cronbach's alpha? To find out 42 items are there. And the Cronbach's alpha is 0.9. For the depression, 14 items are there. Cronbach's alpha is 0.78. So what will be the function of applied psychometrician? Because here item total correlation of these 14 items, sometimes some items may be 0.7, 0.6, majority may be 0.7, 0.6 like that, or 0.75 like that. Okay, so you have to select those items for the intervention purpose. So this is the function of psychometrician. So they are making norms. And based upon the norms, they are making this categorization. But this is the applied psychometrician function. So they are not following any norm. They are following the linear combination of the set of variables. And who are the people who are away from the linear combination of the variables? They are supposed to understand this. So these individuals are basically the outlier. Okay. So whenever you want to give the training, you have to give the training to these people, not these people. So who will be trained? They will be trained. Your training will be imparted to these people, not these people. Why not these people? Then it will be boring to them, but it will not be boring to them. They will learn it if you can motivate them properly. Or for the selection purpose, you have to select these people, but not these people. So here there is no norm. Here I have not followed any norm. Okay. So these are the yes category and this is the no category. So this is the artificial intelligence. And I have followed the machine learning techniques. It is basically the principal component analysis for the advanced applied psychometrician. They are doing this one. Okay. Do you have any question? Hello. Is it clear or it is difficult?
It is clear, sir.
Clear.
Very good. So My task is to equip yourself about the difference between psychometrician and the applied psychometrician. Okay. Now, can you give any case study so that we can discuss? Otherwise, we will close it. If you have any case, you can present.
So normally we do item analysis of multiple choice question.
Yeah, normally we
And-
do the item analysis of the multiple choice question.
So there we get the discrimination index of
Yeah,
each
we
MCQ.
will get the discrimination index. Very
Index
good.
of each MCQ. So
Yes.
just like that, item analysis model I have applied for the spotters. Normally I am a teacher in anatomy. So when we do spotting of the specimen, cadaveric specimen, so I applied that principle and whether the students are able to identify the specimen properly or not. So application of that on the specimen, I counted the discrimination index and then correlated that
No,
with their,
no. Always you think, suppose it is a multiple choice question, right?
Yeah.
So 4 categories of answers are there.
right.
So what will be the equal probability hypothesis?
Means, sir, I did not understand.
Equal chance. A, B, C, D, 4 categories are there. What will be
Right.
the equal chance? What will be the proportion of if it is equal chance?
Okay, means out of that one can be only the correct. So it is 25%.
Okay. So equal chance is 25%. Now, if you find that is in some item, the percentage is 80%. And in some items, it is the 10%. So what does it mean?
Means 0.8 means 80% of the people, if they are marking it correct, then it is very positively correlated or better discriminated than the 0.2.
So what is the function of applied psychometrician?
So our function will be to intervene into that MCQ or spotter where only 0.2% discrimination is there. Why it is happening?
No, you have to think about this 0. What I have told, yes, 0.1 or something, whatever I told. So you have to think that people for the intervention purpose. That means those types of items or those types of questions or those types of concepts are not clear to your students.
That is what I told.
Okay. Then that is the right answer, correct answer.
So, sir, psychometrician.
So what is important? You have to do the error analysis. Error analysis. How much error is there? So less than 25% means not following the equal probability hypothesis. And if it is 0.9, what does it mean? Does it mean that this item has high discrimination power?
So it is getting well
No, sir.
discriminated.
Pooja?
So 0.9 means the item is not able to discriminate between the high scorers and low scorers. Most of the people are able to answer it.
That is
90%
very
of
easy item.
Easy item. That is
Very
the
good.
most.
Very good. Very easy item. Item difficulty level very low.
yes.
So what will be the average? What will be what you can consider?
That is up to us, sir, what level we want to keep.
0.4 to 0.6.
6.
So they are the average. Okay.
Yes, sir.
Any more question? I can take only one question now.
So, sir, here the work of psychometrician stops by just evaluating whether, whereas our applied psychometrician will go into the details and interview. That is what is the okay, sir.
So what will be the function of applied psychometrician? If you arrange the applied psychometrician in your institute, what will be the function? Applied psychometrician will analyze the error, and applied psychometrician will present this data to the experts in anatomy, because this is about the anatomy.
Right, sir.
Okay. Then the applied psychometrician will discuss this issue. What are the underlying features? How to teach? So can you tell me any example, that is which part is very difficult in to understand in case of the anatomy?
There are certain areas like, sir, perineal region is there where it is difficult for the students to understand. Neuroanatomy is there where it is difficult to understand.
Okay. So that is the area. Number one. And number two, if you want to select the candidate, then you have to give this type of item, because the difficulty level is very high. Okay.
Yes.
Okay, thank you. Good night, everybody. We'll sit together on Friday.
Thank you, sir.
Good night, sir. Thank you,
Thank
sir.
you, sir.